I am here with my buddy Jerod. Jerod and Joel, we are going over different exercises combining two professions, profession of personal training, and at Jerod's level, kind of a master trainer doing just a whole wealth of different ways that we can move, and then adding in a physical therapy component, biomechanics, anatomy, all that kind of stuff. And so this topic is going to be further back stretching that we can look at and stuff that you can do at home, sometimes using some equipment. So let's jump into it.
Yeah, so when I'm working with a lot of my clientele, they're looking to get their back stretches out between being sedentary and having them have their low backs take a lot of the attention because their core is not firing. We do want to try and get that releasing in their backs as well, of course, strengthen their core. So when I have them in their training regimen, I'm usually adding some kind of stretches to help that happen. So thinking about that, look, our lats, latissimus dorsi muscles, they originate, so they're on here. They are inserting, what's kind of crazy is they actually insert in the front of the humerus here. So they're going from the humerus, wrapping around underneath, and then originating in the low back. So by you focusing on lengthening through that area, you can get a lot of benefit for the back. So some easy ways to kind of dive into that is, even if you're just around a counter, or in this case we have this firefly, we're actually going to use this as a way to kind of get that going. So knowing that, knowing that our lats, again, insert in our humerus and coming down, you actually can grab onto something, hold onto something, and just let your body lengthen out, and just feel that lengthening going through. Now, what I don't want to see when I teach people this is letting their backs round. It is kind of pushing the hips back and going through.
Well, and one of the other things is most people that, if they're a physical therapist or an office worker, someone who's sitting a lot, this is an area that we get tight. And one of the things that we want to try and do is we want to look at extension through this area. So leading from the front of the chest, so go ahead and do that and kind of, trying to get some extension through this area at the same time. So that was just one thing I'll find for myself because of my tension. And this is a phenomenal stretch. Okay.
And you can change, depending on the flexibility of the person, what you want to feel. Of course, getting lower, down, wherever you want to go, even to the point of being down here. Now, in yoga, one thing that we'll get into, it's a stretch that works well for clients. I'm not really a big yoga guy, but this move I do. As far as being down in the child's pose and lengthening up. And this is where you can kind of play around with flexibility. You can actually have them have their hands close together to add a little more element of stretch to that.
Okay, yeah, you're probably going to get it more from the outside, I think, just from that.
And then you can go to one side. So if I go to my hands to my right, I'm going to push more with my left hip.
Are you adding any resistance at all?
Yes.
Okay, what's going on?
So I'm keeping my hands braced here.
Okay.
Really locking them in, pushing them into the ground.
So pushing the hands into the floor.
Yep, and then I'm going to take my left hip and push that as much as I can into my, so I'm imagining going into my left heel.
So your left hip is dropping that direction.
Yep.
Hands are moving down into the floor.
Yep.
Okay.
And of course, just changing direction, get the other side too. But that's some good ways that you can get that stretch going. One that kind of gets the hips involved too, which you've probably seen a lot of people do this in different sporting events, whatever. Runners like to do this a lot, but lengthening through your here, pushing this leg back. And what I like to do is get the whole entire spine involved, where I'm going to actually look away and have the cervical, thoracic, and lumbar all be involved in this, by pushing through.
And again, it's kind of cool. If a physical therapist or trainer is working with you, putting contacts.
Yep.
Feel that right through there?
Oh yeah, that's actually a much better stretch.
Yep, and then adding a little lift up, so you're kind of doing this, adding rotation, but then also adding a little bit of traction.
Smart, yeah.
So from a personal trainer standpoint, let's say you have a buddy you're working out with, or a personal trainer, or your physical therapist, work on some contact points, okay? On the breastbone.
That's cool.
And then you can, there we go, feel that right there?
Oh yeah.
Okay. Now, at the same time, I think you were adding some resistance. Were you pushing?
Yes. Yeah,
was this one going this direction?
I'm pushing my arm. So I'm keeping my hip, so that's a great point. I don't want my hip to rock this way.
Okay.
So I am locking my hip in the ground, and I am pushing my...
This is like an isometric.
Yeah. So there is some tension. Yeah, so it's not just me relaxing, I am forcing that way. And I guess I could ask you this, would you add force as the trainer or therapist pushing and pushing the shoulder. It was better what you're doing.
Yeah, going back and forth, adding a
Okay.
contraction and letting it go. Working with it, working against, playing around with that. Continue to breathe, make sure you're breathing as this is going on. It's very hard to, very easy to hold your breath for some of these. But definitely playing around with what feels good.
Nice. And then another thing we are going to talk about in this one, these sticks or rods or poles, whatever you have, are a really good way to stretch. I try and brace them between my feet. Okay. And again, whatever you guys have, you can make this work really well. Coming through, pushing the hips down, and again, that same lat stretch can happen. And this does feel amazing.
And again, trying to lead down, like dropping through there. So that's this part kind of leading with the area that matches up with the stiffness in your back. So you feel a lot of tension right through here, leading in that way.
And we all are not symmetrical all the time. So doing things, we're doing one going over to get one versus the other that way.
That looks awesome.
Yeah, it does. And I feel my right shoulder is feeling a really good stretch along with my lats on my left.
You're probably getting some hip stuff as well.
Yeah.
Because Jared's knees are slightly bent.
Yep.
And he is shifting his weight back and forth, and it's these small little hip movements that will stretch right around. So if you have tension around your hip joints, any adductor sort of tension, I think this is a really good one for that as well.